Greetings of health and wellness, everyone. And once again, welcome to Health Future Foundation Incorporated's fifth part of the free long COVID webinar series. And this episode is entitled Breathing Better in Long COVID and Ways to Improve Lung Function. Are you ready to learn more about the long-term effects of COVID-19 on our respiratory system? And of course, I am Nurse Natalie David, and I will be your facilitator for this webinar. This afternoon, we have a lot of people joining us today who are diagnosed with long COVID. Yung iba po ay probable long COVID patients. Some are probable or family members of a long COVID patient, and some are health professionals. And from the bottom of our hearts, thank you so much for spending your Thursday afternoon with us. Once again, magandang hapon po sa inyong lahat. We are glad to have all of you here this afternoon. But before we start, I would like to remind everyone to utilize po ang ating Zoom question and answer box for all of your questions. And selected questions will be addressed during our open forum. And we will also have live questions from our webinar attendees. And once again, use the chat box for your comments. I can see right now we have at least 153 going up now participants this afternoon. And lastly, we value your feedback. So please accomplish the evaluation form within 24 hours after the webinar. Once again, e-certificates will also be provided to Zoom attendees who will stay throughout the program and accomplish the short evaluation form, which will be sent towards the end of the program. Maraming salamat po. And without further ado, I'd like to call on Dr. Jaime Galvestan, the chairman of Health Futures Foundation Incorporated, to give his welcoming remarks. Dr. Jimmy.
Greetings of health and wellness from HFI. My warmest welcome to everyone who is attending the fifth webinar of our long COVID series entitled Breathing Better in Long COVID, Ways to Improve Lung Function. As we continue to advocate spreading awareness on long COVID, or clinically known as PASC, post-acute sequelae of COVID-19, it is equally important that we acknowledge the plight of long COVID patients in dealing with their post-COVID symptoms. We extend our empathy and support to them. Today, we have participants who have long COVID, as well as their family members. We also have healthcare providers and professionals from various industries. I also welcome our resource speakers for today's webinar. I'm excited to listen to Dr. Glynna Ong-Cabrera, an eminent pulmonologist and a pulmonary rehabilitation specialist from the Lung Center of the Philippines, who will discuss the long-term effects of COVID-19 in the lungs. She will be joined by Mr. Adzhar Enggal, a respiratory therapist from the Lung Center of the Philippines, who will demonstrate ways and techniques to improve pulmonary function. I also welcome Mr. Oliver Calasanz, a diagnosed long COVID patient who will share his journey. Once again, thank you for joining us today. As you listen to our speakers, I encourage you to participate by asking questions using the chat box. Maraming salamat po.
Thank you so much, Doc Jimmy, for that welcoming speech. And to start the discussion about post-COVID respiratory symptoms, let us all welcome our first speaker, Sir Oliver Calasanz, who will share his long COVID journey. Sir Oliver is the managing director of the Cancer Resource and Wellness or CareWell Community Foundation. It's a nonprofit organization that provides free psychosocial assistance to patients with cancer and their families. And prior to joining CareWell, he was involved in tobacco control advocacy. His other nonprofit works focus on youth leadership development and promoting access to justice at the grassroots level. His corporate background is in the field of marketing, customer loyalty, communications, and corporate branding. And today, let us all welcome Sir Oliver as he shares his long COVID journey. Sir Oliver.
Hi, good afternoon, everyone. First of all, I'd like to apologize in case my audio gets noisy. My neighbor is having some work done, and I have no control over that. Okay, anyway, uh, when I tested positive for COVID-19 in January 2020, I was surprised that I got it despite strictly adhering to all the precautions and having gotten through 2020 and 2021. Mm, by that time, COVID was no longer as highly fatal as it had been in 2020. I was fully vaxxed and boosted. However, my main concern was not to transmit it to others in my household. First thing I noticed was my throat was itchy and and I had that physical discomfort that presages a cold or flu. The malaise gave way to fever. This was soon followed by a painful cough. My throat felt like I was being stabbed each time I coughed. Even worse was the chest pain each time I coughed. It felt as if I was having surgery without anesthesia and my internal organs were being shifted around. Even coughing, after coughing, the irritation still remained in my throat. Uh, my head felt like I really had a bad morning after hangover, the splitting headache variety. My body ached all over. Difficulty breathing and shortness of breath for even the slightest of exertions followed. At this time, my digestive system went haywire. I developed the worst case of the runs. Already, I could barely eat because of the aches and pains, but regardless of what I ate, I would spend most of my waking hours in the bathroom. I would rush to the toilet just about every 20 minutes. Sleep was erratic because I spent so much time running to the toilet. I was experiencing all the symptoms of a moderate case. Um, so by the third day, I had taken another antigen test, and to no one's surprise, it resulted in a positive result. I felt miserable and wanted to just sleep it off. I was just looking forward to the end of the 2 to 3 weeks of misery. My fever subsided after a few days, but the cough lasted for about 2 months, and I was thinking the bad tummy would sort itself soon, but it didn't. At some point, I did another teleconsult with my pulmonologist, and after listening to my litany of symptoms, the doctor mentioned the likelihood of long COVID. Not only had the bad tummy persisted and it showed no signs of improving, but I was still experiencing shortness of breath and would be gasping at times. I minimized walking around as I often felt woozy, nauseous, and unsteady on my feet. For some time, Sorry. Also, I noticed I had become very forgetful, easily confused and panicky, and irritable. For some time, my work was limited to light administrative tasks. This would mean signing documents, showing up at Zoom meetings. I felt my comprehension was so much slower, almost non existent. I was unable to focus, much less multitask. When I finally had the energy to walk around, I tried to walk my dogs, but I could only go so far as 50 meters before feeling out of breath. I would break into a sweat and would have to turn back towards the house. Also, the unsteadiness of my feet was there. I considered using a cane for balance, but didn't want to make myself look so much older than I already did. I can't exactly determine when I began to experience muscle cramps and spasms. Even when I was not doing any physical activity, like laying on the bed, I'd suddenly experience cramps in my legs. And this was something I'd never or seldom experienced in the past. Yet now it was becoming a regular occurrence. I didn't tie this into my COVID experience. However, this this was something shared by others uh, who were also suffering long COVID. 6 months after recovery, I went to my ophthalmologist. She remarked on the significant increase in my eye grade. Prior to COVID, my eye grade was negative 800. After COVID, this had increased to the negative 1000 range. I don't know if this is in any way related to COVID. 15 months after my COVID infection, going up the stairs is still tiring. Halfway up, I feel my leg muscles struggling. I'm still unable to walk a long distance. Anything beyond 50 meters to 100 meters is the maximum. I'm still heavily dependent on others for doing tasks like walking the dogs or carrying my travel bags. Now I limit my going out only to the most essential trips, including going to the office. I can only manage one trip out of the house each day. And each time I get back home, I sink onto a chair or a sofa, feeling drained and exhausted. I still experience shortness of breath frequently. This can be as a result of some moderate exertion, such as carrying something, or even just walking to the car. From time to time, I use the oximeter to check my oxygen, particularly if I'm feeling dizzy or lightheaded. Because of the fatigue and shortness of breath, I have not been able to resume any exercise routine. My digestive system, although much improved, is still very delicate and sensitive. My trips to the bathroom are still more frequent than pre-COVID days, but nothing like how it was at the height of my illness. I remain very careful of what I eat as I cannot predict how my tummy will react. My ability to accept appointments or attend face-to-face meetings is still dependent on how my digestive system feels at that time. Upon a friend's suggestion, I began taking an herbal supplement to help with the brain fog. I'm sure if this is effective, but I'm willing to try anything. My ability to focus is slowly returning. My comprehension has improved to the point that I'm actually able to do some work, but I'm still unable to multitask and can easily feel overwhelmed. To manage this, I remind myself to choose my battles and focus on completing one thing at a time. This week, I tried going to the office for 3 consecutive days. By the third day, which was yesterday, I decided I'd have to cut back again and insert a rest day in between. Overall, the impact of long COVID on my working life has been significant. There are workarounds for my private life activities, but at work, I need to be mentally present and running at 100%. The question is, how long will the long COVID situation last? Science has yet to come back to us with the answer. Thank you.
Thank you very much, Sir Oliver. Very, very relatable. I was listening to you, and there are also points that I have experienced the same thing. So later on, for all of our participants, you may choose to click the Q&A Zoom question and answer box for your concerns later on or questions to Sir Oliver. And to start the discussion about breathing better in long COVID, ways to improve lung function, let us all welcome our speakers. Dr. Glynna Ong-Cabrera is an eminent pulmonologist and a pulmonary rehabilitation specialist from the Lung Center of the Philippines. She is a diplomate of the Philippine College of Physicians and Philippine College of Chest Physicians. In 2019, Dr. Ong-Cabrera was awarded as the most distinguished public servant by the Philippine College of Chest Physicians for her efforts on tobacco control. And she is the current program director of the Lung Center of the Philippines Smoking Cessation Program and the Department of Health National Smoking Cessation Quitline. She is also the program director of Lung Center of the Philippines COPD, or that's the Chronic Obstructive Pulmonary Disease and Bronchiectasis Support Group Program. Dr. Glynna Ong is also the section head of the Pulmonary Rehabilitation Section of the Lung Center of the Philippines and a visiting consultant at the Philippine Heart Center and the training officer in the Department of Internal Medicine in Capital Medical Center. Dr. Glynna Ong-Cabrera is joined by Sir Adzhar Enggal, a registered respiratory therapist from the Lung Center of the Philippines. He obtained his degree in respiratory therapy from the Universidad de Zamboanga. Mr. Adzhar is an experienced respiratory therapist in several respiratory care management areas, such as basic life support, cardiopulmonary resuscitation, also chronic disease pulmonary rehabilitation, perioperative pulmonary rehabilitation, lung expansion therapy, inhalation therapy, and pulmonary function testing, among others. He will demonstrate ways and techniques to improve post-COVID lung function. Let's all welcome our speakers, Dr. Glynna Ong-Cabrera and Sir Adzhar Enggal, as they discuss and demonstrate breathing better in long COVID, ways to improve lung function.
Good afternoon, everyone. Can you hear me? Yes. So, good afternoon, everyone. And that's magandang hapon po sa inyong lahat. And I think some of our members are from Mindanao. So maayong hapon sa inyong tanan. So for today, we will be discussing on the role of pulmonary rehabilitation in patients with long COVID, as was mentioned earlier by our speaker. And he narrated all the difficulties that he had been experiencing. So may I have the access for transferring my slides? Or next slide, please.
Hi, Doc. You can request for control.
Yes, can I request for control?
Yes po. Can you click the view options po? The upper part of your screen.
View options.
And then...
there. Okay. Yes, got it. Okay. So got it. Thank you. So Okay, so for our learning objectives, first of all, we'd like to describe a long COVID patient. And sorry, yeah, to briefly discuss or describe long COVID patient and the challenges that they encounter, and to discuss the basic principles of pulmonary rehabilitation and its role in the management of patients with long COVID, and to discuss the components of pulmonary rehabilitation. So I'd like to define first what is post-COVID syndrome. Post-COVID syndrome is usually symptoms that is experienced by patients who had experienced COVID, which it persists roughly for more than 4 weeks, and it occurs after first being infected. And usually in the study in the US, they found that only 65% of patients had actually returned to their previous level of health after positive test. So usually, even after they recover, they usually experience certain symptoms such as phlegm, chronic cough, and difficulty of breathing, which therefore cause them to have poor quality of life. And also, if you look at the timeline of COVID, usually after the person's exposure, usually the COVID virus stays in the respiratory tract roughly for like 2 weeks, but it persists for more than 4 weeks. Although the viral load decreases, the patients usually still complain of various symptoms such as fatigue, joint pains, dyspnea, cough, anxiety, post-traumatic stress disorder. Usually the patients will complain of chest pain and palpitations. And usually what is challenging also for most post-COVID patients complaining of respiratory symptoms, usually they will have shortness of breath and chest tightness that will require bronchoconstriction. They would usually tend to need oxygen therapy. So usually they will use their pulse oximeter more frequently just to check if they need to increase their oxygen requirement. And because of this, patients will have problems in terms of physical disability and airway clearance. So ibig sabihin po, medyo dumadami po ang plema. So there will be phlegm, which may be even difficult to expectorate. So usually patients, as was mentioned, will have these various symptoms, but majority will complain of fatigue, chest pain, and shortness of breath. So usually I just like to show a chest x-ray of a patient, or actually a chest CT scan of a patient who has developed post-COVID fibrosis. So as you can see, there are damage in the lung parenchyma. There will also be changes in terms of the airways. So usually, if we do a pulmonary function test, there will be what we call restrictive airway diseases. So ang nangyayari po bale, yung daanan po ng hangin ay lumiliit po siya at nagiging restricted. Therefore, or obstructed, therefore nagkakaroon ng restriction po sa paghinga or difficulty or restrictions in the breathing patterns. So usually, the incidence of post-COVID syndrome is estimated at 10 to 35%, but patients who are hospitalized may actually even reach as much as 85%. But most of these patients have comorbidities such as hypertension and diabetes mellitus. So in a study conducted by Merad Nabahati among patients who had COVID, it was also noted that post-COVID lung fibrosis was observed in about half of the survivors. And patients experienced diminished fibrotic abnormalities in their chest CT scan on 6-month follow-up, while others did not. But actually, most of the patients that we have encountered at the Lung Center of the Philippines, when we checked their CT scan after pulmonary rehabilitation, we have observed that there was really quite an improvement in terms of the fibrosis noted in their CT scan. So what are the predictors of pulmonary fibrosis? So usually patients who tend to develop pulmonary fibrosis are those who are smokers, having severe illnesses, advanced age, long hospital stay in the ICU, and patients who are using or drinking a lot of alcohol. And usually, just simply lying sick in bed, patients will tend to have muscle atrophy, and usually they will lose 1% to 1.5% of their muscle strength per day. So if you add that approximately 8 days, just simply lying down, patients will already lose 12% of their muscle strength. So this could explain, other than just the simply the lung function or the difficulty in breathing. Other than that, there is also a component of what we call muscle deconditioning due to simply lying down. So usually, because of that immobility, major muscles that affect respiration are also affected, as well as muscles that will impact in terms of endurance and strength whenever we do certain activities. So one of the main muscles that are affected is the diaphragm, which is the main muscles that helps the lung expand and contract. The core muscles usually are also affected, as well as the gluteals, and they tend to atrophy quickly. And these are important muscles because these are the muscles that help us walk and stand. And usually, because the patient is usually just simply lying down and doing, of course, less activities, so patients will have what we call difficulty of breathing due to peripheral muscle impairment as a result of inactivity. So therefore, we should be able to break this spiraling down of inactivity going into invalidity or poor quality of life. Okay, so there are certain factors that also contribute to exercise intolerance. So other than, of course, the respiratory or the ventilatory limitation, which results from COVID, we also have problems with skeletal muscle dysfunction, as was earlier noted, and cardiac. So it is not only a component of the respiratory system, but it also involves the cardiac and the skeletal muscle system. So if we put them all together, so we have a patient who is breathless. And because of this breathlessness, most of our patients will be complaining of anxiety because of the fear of having difficulty of breathing. And because of this, patients will tend to avoid movement, and they will tend to be just sitting down most of the time. Hence, there will be atrophy of the muscles, affecting therefore activities of daily living and functioning. So usually this would eventually lead to poor quality of life, and patients will actually have fear. And because of this fear, they will be isolating themselves. They will be overprotective of themselves. What do I mean by that? If they feel even just a simple or a little sense of discomfort, they will just sit down and not move at all. And because of this, it will be more difficult for this patient now to improve in terms of having interactions with family, friends, and the community. And eventually, patients will become weaker and weaker each day, leading to a poor quality of life. So our patients need therefore to improve in terms of exercise capacity, functional capacity. We want them to improve their dyspnea or difficulty of breathing. We want to decrease anxiety, and of course, to improve quality of life. So therefore, what now is the role of pulmonary rehabilitation? Pulmonary rehabilitation is one of the most effective management strategies that we do to improve shortness of breath, health status, and exercise tolerance. It is important that we improve exercise tolerance because it enables us to perform what we call activities of daily living without due fatigue. And of course, if a patient is able to perform usual activities, then this will also lead to a reduction in terms of anxiety and depression. So it is a comprehensive intervention wherein we do exercise training and we educate our patients with regard to the disease itself. We try to educate in terms of the medications, how to avoid the triggers that will trigger difficulty of breathing. And of course, we also help in terms of behavioral change. And we hope to improve physical and psychological conditions of patients with chronic respiratory disease due to COVID. So the goals there for a pulmonary rehabilitation is we want to decrease their shortness of breath by increasing exercise tolerance. Hence, this will improve quality of life and hopefully decrease hospitalizations and ER visits. So we want our patients, therefore, to be able to perform activities of daily living, to be able to participate in community activities, family affairs, family events. We want them to enjoy life and be with their friends. So we hope to help them break free from just being confined in the rooms in isolation and being important and perform important roles, not only in the family, but as well as in the community. So one of the factors or the things that we should also do is help our patients in terms of sitting and standing, because most of our patients are simply lying down. You want them to sit and stand because it improves also lung expansion when they are sitting and standing. So we should tell our patients, or if we are caregivers, we should encourage them to be sitting down. And if they are sitting down, we help them to stand up. So normal ventilatory function actually depends on a balance between ventilatory demand and ventilatory capacity. And the respiratory muscles play an important role in achieving this balance. So therefore, we should be able to help our patients by providing them with certain activities that would improve this. And usually, breathing muscles are weakened because of the disease. Therefore, we help them by improving their respiratory function through respiratory muscle training. So if you note, most of our patients who are, especially those who are anxious, rather than breathing usually rather than using their diaphragm, they will be observed to be doing shallow breathing. So they will be using their clavicles as shown in the animation here, or they will just try to elevate the ribs in an attempt to expand their lungs. But we can also use certain devices such as the incentive spirometer. This patient is actually very special because it led to him having a tracheostomy, but we still try our best to help him by using the incentive spirometer to help him improve lung capacity. Usually, several studies have reported also that beneficial effects of in-hospital exercise programs for patients with pneumonia improve by doing certain stretching, walking, and muscle strength is improved by using light weights or TheraBands. So as oops. There. So this is one of our patients. Ooh. So this patient is actually, this is a video. Anyway, that's supposedly a video wherein our patient there was able to walk even if he was on mechanical ventilator. That patient was referred to us after 3 months of just being inactive, lying down. And then we started with doing upper extremity exercises, lower extremity exercises. And then eventually we asked her to stand. So our patient, even though she's still on although it's a low oxygen support already, she still usually is on mechanical ventilator during the evenings. So this is her walking around the room. Okay, so other activities that we could do to improve lung compliance is through pursed-lip breathing, positioning, deep breathing, diaphragmatic breathing, and stretching. Usually in pursed-lip breathing, we ask our patients to breathe 2 seconds through the nose and exhale through the mouth approximately 4 seconds. In positioning, it also helps improve lung expansion, and also decreases the weight on the lungs when the person is lying in a certain position. So this is an example of diaphragmatic breathing. So usually when diaphragmatic breathing, you inhale through the nose and then you fill your lungs with air, but your abdomen expands as you do that procedure. You allow your abdomen to expand so that it allows the diaphragm to go down to allow more air to come in. And then after that, after like 2 seconds of breathing, you exhale as your abdomen contracts inwards. So mindful breathing is also one of the things that we could do. It incorporates breathing strategies, including the pursed-lip breathing and the diaphragmatic breathing. But this time, we are concentrating on our breathing. We are relaxing. And in that way, we clear our mind and we calm ourselves. Usually, we are capable of voluntarily breathing, because sometimes when we just are we allow our fear or anxiety to take over, usually it will lead to hyperventilation, increasing our respiratory rate, increasing our heart rate. So we try to control this by doing mindful breathing. That means we clear our minds, we relax, and then just concentrate on our breath. So we also incorporated just recently singing in terms of being able to improve our lung capacity. Because if you note, when we actually sing, we have the same breathing pattern. So when we inhale, we also let our diaphragm go down and expand a bit our abdomen. And as we push our abdomen and the voice comes out, we are able to control exhalation, but we are also able to control it. So in terms of as we support the tone that we are actually producing. So in this way, we reduce shortness of breath, we increase the strength of our voice. At the same time, it improves our posture, our lung capacity, and it boosts our response to infection. So this is us. This is one of our classes wherein we are instructing our patients to sing a certain song. And we note, if you note, one of our patients is holding onto the diaphragm so that he is aware of the contractions of the abdomen and the chest as he's actually doing the singing. So for airway clearance techniques, so we also do the Huff method. So usually you take a deep breath for like probably 2 seconds, and then we blow out the air in 3 even breaths. And we do the active cycle breathing technique as well. I think Joey will explain that further later on. And then for exercise training, we do walking exercises, and even those patients with severe lung disease can still sustain the necessary training intensity for skeletal muscle adaptation to occur. So for stretching exercises, actually, we increase the compliance by as much as 50 ml. So we also stretch our neck, upper chest, and muscles of the chest as well. So we do endurance exercises and strength training. But of course, we incorporate the breathing exercises as we do these exercises. Like for example, in the lifting of the weights, so we inhale, 2 seconds, and then exhale. Inhale, exhale. So usually the movement is during exhalation because exhalation is passive. So we concentrate now on the inhalation and do the same thing as we are walking up the stairs. So we allow a certain time for us to rest. So we inhale, then probably 3 steps up, 1, 2, 3, doing the exhalation, then inhale, and then exhale, going up the stairs. So, and then we also have upper extremity endurance exercises using the arm, cycle ergometer, and stretching exercises. Sometimes we also use Tai Chi exercises to improve flexibility. And we usually do Zumba exercises as well to improve endurance, flexibility, and strength. And of course, it's fun to do for most of our patients. So oxygen supplement may also be used as to maintain the pulse oximeter at approximately 90% oxygen saturation. So for the education, we teach our patients goal setting, problem solving, and decision making in terms of managing their condition. And usually these are the topics that we talk about. We talk about anatomy, physiology, how to cough out the phlegm, diet. We also talk about psychology and mental health and sexuality. And the challenges during the pandemic is, of course, we are basically at home and unable to go around. So we have incorporated telerehabilitation as a form of giving instructions to most of our patients. And usually, like for example, this is one of our patients, and she was able to perform exercises. Initially, when she was referred, initially when our patient was referred, she was actually even unable just to lift the hand is very difficult. She was on mechanical ventilator for a year before she was actually referred to us. She is in Bicol, so we are coaching her from Lung Center, and she's in Bicol. So before, she can hardly move, but now she's able to do certain exercises using her legs and her arms. So usually this is our program. It's a 4-week program, and usually we do 6-minute walk test before the activity so we can measure the functional capacity and do certain activities such as endurance and strength training. And usually, again, as noted, our patient who was initially unable to move is now able to stand. Although she's still on mechanical ventilator, but she's in the weaning process. We also have conducted a study, and we have found that our patients have improved in terms of quality of life. So they have improved in terms of quality of life and exercise capacity. So these are our patients during their hybrid graduation. So we still allow our patients to remain in the Zoom if they prefer to. But for those who want to come to the clinic, they can also we could also conduct training or exercise training at the Lung Center. So in summary, we follow the ABCs, stay active, do the proper breathing exercises, and of course, cheer up and let's have fun. So thank you.
I guess we'll proceed to Sir Adzhar for his presentation, sir.
Good afternoon po. Hi, good afternoon. My name is Adzhar Enggal. I am a respiratory therapist. And magandang hapon po. I'm surprised and glad that we have foreign people here. And I'm sorry that I made my presentation in Tagalog, but I'll try my best to explain it in English. Okay. For a while. So ways to improve lung function. So first, we have breathing exercises. This one has been explained by Dr. Cabrera. Since she explained it in English, i-explain ko na lang po in Tagalog so we can also consider those other people. First, the breathing is done by 4 steps. We have hinga sa ilong ng dahan-dahan, 2 segundo. Inhale through your nose. And then position your mouth as if you are whistling. And then slowly exhale while doing the first lip. And then number 4, repeat the process. Note, kung gaano kalalim ang paghinga sa ilong, dapat ay mas habaan natin ang paglabas ng hangin sa bibig. So yun po yung first lip breathing. Next, we have diaphragmatic breathing. Diaphragmatic breathing is usually associated with whole body exercise. Ginagawa natin siya kapag nag-workout tayo. So, we have 7 steps for diaphragmatic breathing exercise. First, i-relax yung balikat at dibdib. Next, ilagay ang kanang kamay sa dibdib at ang kaliwa sa tiyan. Number 3, huminga sa ilong nang nakasara ang bibig for 2 seconds. Habang humihinga, kailangan unti-unting umaangat yung ating tiyan kasi andun po yung ating diaphragm. After that, isang buga ng dahan-dahan sa mouth while positioning nang nakawisel yung bibig. Habang bumubuga, dahan-dahan, subukan po nating lagyan ng diin ang tiyan para matulungang ilabas ang hangin. Number 7, ulitin po ang proseso ng 5 beses o mahigit. Next, aside from breathing exercises, we also have positions that can help relieve our difficulty of breathing. Okay, we have number 1, sitting, number 2, standing. Sa sitting po, we can position ourselves sa chair, nakaupo tayo, ilagay yung kamay sa lap, and then do the proper breathing. O kaya naman, maglagay po ng table while sitting, and then you can put a pillow, and then relax and do the breathing as well. Yung sa standing naman, you can stand, and then yung back, make sure nakalatag sa wall. Relax your shoulders, leaning, and then yung kamay po nakalaylay. And then do the proper breathing. Okay. Yung isa naman pong nakatayo, yung chair ay nakatayo kayo sa chair, yung kamay nyo ay nakalatag sa chair, and then do the proper breathing also. Okay. Next, we have chest physiotherapy o pagpapalabas ng plema. Why do we need to clear our secretions? Bakit natin kailangan mailabas ang plema? Okay. We have reasons. First, upang maiwasan ang pagkakaroon ng paulit-ulit na infeksyon sa lungs at tuluyan itong masira. Also, upang hindi magdulot ng pagbabara o obstruction, airflow limitation, para guminhawa yung ating paghinga. Next, also para mabawasan din yung ating self-esteem. Siyempre, kapag may plema tayo, siyempre, hirap tayong ilabas tapos nasa crowd tayo, medyo mahihiya tayong umubo ng umubo. And lastly, to improve the quality of life of the patient. Yun po yung mga rason kung bakit natin kailangan gawin. So anong dapat natin gawin? First, panatilihing uminom ng tubig para lagi tayong hydrated. Also, iwasan ang paninigarilyo, quit smoking, or lessen your smoking frequency. Itigil o bawasan ang pag-consume ng alak, regular exercise at pagkain ng wasto. Gamitin ang tamang gamot sa baga na nireseta ng doktor, and also paggamit ng technique sa pagpapalabas ng plema. So we have also breathing technique that we can do without the device para mailabas po ang ating plema. Ito pa, this has been discussed by Dr. Glynna, active cycle of breathing. So yung active cycle of breathing, we have 3 phases, 3 cycles of breathing. Number 1, we have diaphragmatic breathing exercise, thoracic expansion exercise in number 2, number 3, huffing. Okay, let's do it one by one. Number 1, diaphragmatic breathing. The reason why we do diaphragmatic breathing is para lumakas ang ating muscle sa paghinga na tinatawag na diaphragm. Yun po yung nagsusupport sa lungs natin para maglabas ng hangin at magpasok po ng hangin. Okay? Ito po. I'm going to show you a video of how to do it. Okay. As you inhale through your nose, umaangat yung tiyan. Then, while exhaling, gently put pressure on your abdomen to help the lungs release the carbon dioxide o kaya yung hangin na natatrap sa lungs. Okay. Next, we have thoracic expansion exercise. The reason naman kung bakit siya ginagawa, to mapanatiling maganda ang pagkuha at paggamit ng oxygen, the utilization of oxygen na nilalanghap natin papunta sa baga at ma-distribute sa buong parte ng ating katawan. Okay. So, ito po. This is how you do it. So, okay. Hands on your both sides. Breathe in through your nose. Then, see. As you can see, after inhaling, there's a pause in between to make sure the lungs has expanded, and then slowly exhale to release the air. Next, we have huffing. Huffing is natural na pagpapaangat ng plema upang may labas at may ubo ng maayos. We do this if the secretions of the patient is in the proximal area, like malapit na siyang ilabas. So, this is how we do it. I'm going to show you the video too. Okay. Inhale through your nose, then position your mouth na parang pa-O siya, and then forcefully exhale without using your voice. You can forcefully do it or prolong it. That's it. That's for the breathing technique. After doing that, we can proceed to the proper coughing naman po. If we have the proper breathing, we also have the proper coughing to make sure that if the cough has been secreted or the cough will be effective. Okay? We have 3 steps for the proper coughing. Number 1, hinga ng malalim sa ilong. Inhale, deep through your nose. Then try to hold it 3 to 4 seconds. Then as you exhale, sabay po yung pag-ubo. Kailangan. 2 ubo. Kasi when we inhale, the air comes into your nose, your lungs gets expanded, and then as the lungs expands, the phlegm or the secretions gets compressed, and then that's the time you have to exhale, and then kasabay yung pag-ubo twice. Okay, next. Aside from those breathing techniques, we also have the positioning. The postural drainage po, it depends on the affected area of the lungs. So let's say for example, you have here, so number 1, affected yung kanyang anterior upper segment dito sa may taas. So ang keynote lang po dito is the affected area should be on the upright position. So, okay. This is done usually 3 to 15 minutes and then 4 to 6 times a day. Okay, we also have machines or devices that can help clear the secretions. We have here the high frequency chest wall oscillation. This is how I do it in the area. The high frequency oscillation, it provides the positive pressure on the chest of the patient. And then also it oscillates to the chest to make sure the secretions inside the lungs is being mobilized and then properly expectorated or suctioned by the nerves or the arteries or the PTs in the wall. Okay. Also, we have the cough assist machine. The cough assist machine is a device used to treat patients that are they cannot easily expectorate, or they have neuromuscular problems, and they have problems in coughing. This is done non-invasively by giving pressure to the patient's mouth into the lungs, positive pressure, and then during exhalation, it gives negative pressure. It's like parang yung sense niya po ay parang vacuum, yun po yung sense niya. And then while exhaling, the negative pressure also provides oscillation as well to mobilize the secretions. We also have here the turbo fort. The turbo fort is the same thing with the cough assist, but it does not have a control. It's like a manual. It should be done by a patient, an effort. Okay? You have to exhale through the device, and then it has a ball that oscillates as well during the blowing. Okay. Next, we also have the incentive spirometer. The incentive spirometer, it's a breathing exercise device that helps the lungs expand as well to make sure that the lungs is, usually it is prescribed to the patient post-operatively to prevent further pulmonary complications by enhancing the oxygen utilization and enhancing the strength of the muscles of the respiratory, the lungs. Okay, as you can see, there's a volume, a number here. You can, when you are doing the procedure, the numbers are indicated here of how much you can achieve. Okay, we also have the percussor and the manual percussion. The percussor acts as a airway clearance device as well that provides oscillation outside of the body, and the manual percussion as well to help the clearance of the secretions. Okay, thank you. That's it.
Thank you so much to our speakers, to Dr. Glynna and Sir Adzhar for the very informative discussion about the long-term effects of COVID-19 on our respiratory system and for demonstrating techniques to improve lung function. Thank you so much, sir. I was writing it down and also had a few questions that will be asked later on. With this, let's proceed to the open forum. And so everyone who's still with us, we highly encourage you to send in your questions via the Q&A box kung kayo po ay nasa Zoom, and in the comment section if you're joining via Facebook Live. So once again, Sir Oliver, Doc Glynna, and Sir Adzhar, good afternoon po. Requesting to turn on your
good afternoon.
cameras. Good afternoon, sir. And good afternoon also to our 181 participants who are very, very interested to learn more about our discussion. I guess I'll start off with the first question for Sir Oliver. Ayan. May question po here. Sir, what are your methods daw po and practices for you to be able to cope up with your long COVID symptoms?
Sorry, what was the question? What are my
methods and practices daw?
Okay. Well, unfortunately, I'm like what Dr. Glynna mentioned. I minimize activity.
Yeah,
I really minimize wherever I can. I really, as I mentioned, I go out only once a day, if at all. I'm cutting back again on my going to the office because I noticed I really can't yet do consecutive days. And then, well, even just going up and down the stairs is already tiring for me. So, uh, yeah, what I would say is my exercise would be walking the dogs in the afternoon. No, pero so I have three dogs. So it's basically I walk 150 meters kasi 50 meters each dog eh. So yeah. Um, Going to the groceries, to the supermarket is already walking around with the shopping cart. Yeah. At least kasi I'm holding onto the cart. So if I feel tired kahit paano, I sort of put my weight on that. That's about it. No? I'm really not able to start any exercise routine yet. It's been suggested I try swimming, so I might do that because yeah, and also to help with the breathing. Pero yan nga. I'm still at that stage of partly out of fear, so I minimize activity.
Thank you so much, sir. This question is coming from one of our participants for Doctora. Doctora, I had COVID last July 2022 and suffered from otitis media for a very long time daw po. And ang naging dahilan daw po is yung participant po natin lost ang kanyang hearing sa kanyang left ear. He or she is asking, can this be a part of long COVID too? And meron din po siyang fatigue, cough, and headaches. Thank you po.
Yung otitis media, I think it may not necessarily be due to the COVID because most of the time it's bacterial in nature. So we usually just ask, most likely the ENT will give eardrops, chances are. But the fatigue, yes, it could be possibly because of the long COVID. And it's an interplay of, as was mentioned by Mr. Oliver, fear. So it's really a psych thing also, that because there's trauma, getting COVID during the 2021 was not really a very easy event, if ever, in your life, because other than, of course, feeling bad, feeling sick, you are isolated, and so that even adds to the trauma and the anxiety, and you don't want to experience that all over again. And then usually because of minimizing the activity, so your muscles shrink, your muscles weaken, and then in effect your lung expansion doesn't improve kasi usually just sitting down. When we actually exercise and do breathing exercises, there's a lung expansion. And then we also, on top of the adaptation of exercise, there's improvement in not only in muscle bulk, but also the circulation. So it improves circulation and oxygen utilization. Kasi parang I would usually compare it sa car na wala sa kondisyon. Di ba? Normally, pag hindi kulang sa tune up yung car, di ba? So we tune up our body by doing exercises. But hindi naman necessarily dapat fearful kasi some will say, oh, I just walk 100 meters. That's fine. We will say, that's fine. You start with 100 meters. But tomorrow, make it 120. Then tomorrow, another day after that, make it 150. But you have to incorporate the breathing exercises. So inhale, one, and exhale, 1, 2, 3. So you do the movement with the exhalation because relax kasi ang exhalation eh. It's passive. So at least you concentrate on your breathing. So at least that's at least how he could improve.
Thank you so much, Doc. I think we have one live question from Sir Rupert. Sir, good afternoon. Ayan, Sir Rupert, I think he raised his hand and he has a live question. Is he in the room? Sir?
Hello. Good afternoon. Am I being heard? Yes, hello, good afternoon. Thank you. Yes, thank you very much for the webinar being given to us today. I have two questions. Would that be okay? First one would be um, is are guided swimming exercises can help improve lung function for long COVID patients because it is it somehow rings to a lot of asthmatic patients that swimming help them improve their lung function. So that's my first question. And second question, I was actually interested by how singing can actually improve lung function for long COVID patients. So my question would be, is there any kind of songs recommended to best improve lung function? Are there any parang standard songs that can be sung by patients? Thank you very much.
Okay. So I'll answer. So for the first question, swimming kasi yes, it could be one of the exercise activities that you can do, but as a whole talaga, exercise in general can really improve lung function. And of course, kasi how does it improve lung function? As I mentioned, it improves kasi also your respiratory muscles kasi people think na it's just about the lungs. The lungs kasi is parang lagayan lang yan ng hangin eh. The one problem that you have to encounter is ipasok yung lungs, getting air into the lungs, and that's already an effort. So it takes strong respiratory muscles, or at least conditioned respiratory muscles, to get the air into the lungs. And then eventually, you need again the muscles to exhale, to get the carbon dioxide out. So I would say any form of exercise, but swimming kasi, when you're in the water, may resistance siya eh. So when you're actually inhaling against resistance. So, di ba parang sa nag-gym yan eh, you add resistance. So you use weights, you use stretch or therabands or elastic bands to add a little effort or resistance or weights para syempre when you add weights you're going to exert more effort, and then your muscles will sense that, oh, I need to grow a bit bigger so I can do these activities regularly. So when you are actually swimming, you're breathing against a certain amount of resistance. So yeah, that's good. And usually what happens is not only the muscles, we're also thinking we're also considering yung breathing techniques. Kasi our main concern usually is to train the people to breathe properly. Kasi yung umaakyat ng stairs, di ba Sir Oliver, if you notice, you'll take a deep breath when you're about to go up the stairs. And then you go as fast as you can na hindi ka maubusan ng air sometimes, or for most patients. Kasi babaon sila ng air ba hanggang sa makarating sa taas. And then dun sila maghahabol. Doon sila maghahabol. So usually, instead of the steady pacing na breathing, so usually that's usually the common mistake. So usually, pagdating sa taas, hindi na nababawi. So usually, we try to pace the breathing. So that's why yun yung first lip breathing, the huffing, so and the expansion, the diaphragmatic breathing. So that is where it comes in. You control the breathing. Hindi po tayo hyperventilate. And usually, may kasama na rin yan anxiety eh. So usually, feeling kasi natin we're getting more air when we increase the rate of our breath. But actually, nahihilo lang tayo. Kasi kumbaga sa pump yan, di ba? Ito yung lungs natin na pump. Kung mabilis ka, ganyan lang siya. So you're just getting a little air. Unlike you inhale, breathe in, and then exhale. So you get more air and you expel more carbon dioxide. And then going to the singing, there are studies in European respiratory journals in Singapore. They incorporate breathing as singing and breathing kasi pareho ang techniques sa singing and sa proper breathing. Kasi 'di ba, if those who are part of the choir, your coaches or your conductors will say diaphragmatic breathing from the diaphragm, 'di ba, sasabihin nilang ganon. And then when you breathe, inhale, and then exhale, they will teach you to expand your lungs. So, and then when you actually are singing, so inhale, and then when you exhale, that's the time you let a sound come out. So, kunyari, inhale, exhale, ha, di ba doon siya lalabas? So, and then, hindi parang, hindi naman ganun, di ba? So, inhale, and then you support with your diaphragm. Gagano siya, di ba? So now, going to the song, napag-usapan na namin yan ni Ma'am Becky. Kasi she was talking about jazz. She was talking about the fast songs. So I was telling her, you just sing something that is relaxing. So yung ano lang, and usually sabi ko nga, you can start with the Filipino songs kasi maraming a, e, i, o, sa ending yun, di ba? So, parang, 'di ba, kunyari you're singing, yung kanakanta namin, like kahit maputi. So, ano ba yung first line? Dahil may matanda na, sana'y di tayo magbago. So, so mas madali siya i-control as compared to mga jazzy na mabilis yung songs, difficult to control the breath. So you can at least start with that.
That's very well noted, ma'am. That's really a good idea, no? Naku, thank you so much po, Doktora. Now we can choose or pick our songs on our playlist, no? Some of us are also noting it down. We have one more question here from our long COVID patient. My lungs were affected. I have attacks of shortness of breath. I have a spirometer and I reached up to 750 to 1,000 level only. Ito po ba ay low level daw po? And how often should I do the spirometer exercise to improve my lung function? I think the question goes to Sir Adzhar or Dr. Glynna.
Si Choi muna. I'll let Mr. Enggal answer first.
In regards to that, we should not focus on the level of the volume that has been reached by the patient. It should be done consistently. Usually we do it in the ward, like every hour, we do the breathing maneuver for 10 times. So as you consistently do the procedure, from time to time, the reach amount of volume that you can achieve is also increasing. So yeah, that's it. You don't have to stress out. You just have to do it consistently.
Just to add, most of our patients started with 300. Yeah. So, and with constant exercise and doing the procedure consistently, 750 is okay. And then if you keep doing that, it can even increase further. Kasi yun ang ano talaga essence ng when you're doing exercise activities. It's part of the respiratory muscle training or exercise. Diba, when you are running a marathon, you don't of course start with 5 kilometers. Usually doon ka muna sa 100 meters minsan for some, diba? Then maglakad ka na lang. And then later on, magiging 500 na yan. And then magiging 1 kilometer na yan. And then, but it takes patience. And persistence, of course.
Thank you so much, Doc. And Sir Adzhar, another one. This is a good question. Is it possible daw po that you can still experience the symptoms of a long COVID even if it's 3 years ago? Kasi siya daw po nakaka-experience pa rin daw ng pagkahapo sa konting lakad lang, even hospitalized due to palpitations after walking. Any of us three can answer these questions po.
It depends kasi, like for example, yun nga yung patient namin na that video, hindi ko ma-on yung video, sorry. But when we started with that patient, actually naka-ventilator siya sa bahay. She was just 1 year na siyang naka-ventilator sa bahay. And talagang yung setting ng ventilator niya is at 55%. Mas mataas yun relatively. So 1 year, walang nangyayari kasi wala siyang ginagawang other than just lying down. And then when we started doing some exercises, in like 6 months, she was able already to stand. So what I'm trying to say is, pwedeng yung fatigue niya could have started as a long COVID, but if you're not exercising and doing anything to improve your endurance, then of course you will feel fatigue. Kasi yun yung nasa sinasabi natin na fitness as well. So I think that's my answer to that question.
I think, Sir Oliver, have you experienced the same thing even after years past?
Well, yes, I had it in January of 2022. So it's about 15 months after, and I still have the same problems. It's a little bit, like I said, my digestive issues have improved a bit, but it's still there. Respiratory is still bad, but yeah, there's just a slight improvement, but it's still there.
May I add, Natalie?
Yes, ma'am.
Also just to kasi parang baka hindi nila na-visualize kasi I was talking about ventilators. But we had a patient, actually she's a doctor. After she was hospitalized, really critical. She was intubated, and then talagang 50-50, you could say. But luckily she survived. And then before she was enrolled in our program, she was, of course, discharged and was at home, not practicing her being a doctor. And then she was on oxygen therapy 24 hours for like maybe 4 to 5 liters. So she was just sitting there. And then she said, I should do something. So after 8 months of waiting, thinking that she will just, improve eventually. So after 8 months of just, doing nothing just with the oxygen, she decided to join our group. We have a support group. And so after like 2 months of joining our group, she went back to her private practice, and she's not using oxygen anymore. So what I'm trying to say is, yes, the symptoms can still be there, but it may lessen if we are able to do certain exercises or certain strategies.
That's a good advice, Doc. Because to me, I can still see that meron pa ring effects ng long COVID, Especially yung pagkahapo also, like I was doing boxing before. I was doing my sport before. But then I'm so scared to go back kasi parang feeling ko baka mas mahapo ako. So that's a good advice, Doc, no? To everyone who are experiencing long COVID. If you want to go back running, you can ask your doctor about it and then maybe do a little bit of activities to get your lung function. But of course, it's a different case to Sir Oliver. I guess it's parang kumbaga little by little taking baby steps lang din muna, no? Until such that we get to get our lung function back. Ayan, thank you po, Doc.
Just to add, wag lang sila masyadong ma-pressure kasi sometimes you compare yourselves with others. You compare yourself with what you were capable of the day before. Diba? So, kahit 10 steps ang in-improve mo, okay lang yan. Like, for example, for our participants, we ask them to have a pedometer. Pedometer is yung uso ngayon, diba? Yung cellphone nyo, your phone, your even watches have pedometers. It will track down how many steps you're actually doing for the day. So, for our participants, we ask them to report to us. And sila mismo nakikita nila, like, for example, sa start, they report to us kasi every day for example 1,000 steps lang, and then you can see at the end of a month nakaka 2,000 steps na sila So little steps lang. It doesn't have to be, you're running the marathon or you're going back to your heavy exercise activity. Even just, simple walking. So let's be kind to ourselves. Let's not pressure ourselves, but we have to move forward.
Yes, we have to move pa rin. Thank you, Doc. Ito po, from a community health nurse. Okay, as a community health nurse, we are familiar in educating our community patients to cough out daw po yung plema or the phlegm by asking them to do the breathing exercises or steam inhalation. and ask a relative to do the bronchial clapping. Is it also the same for doing lung percussion? Dun daw po sa mga long COVID patients?
See.
Sir Adzhar?
It's the same technique using like a bronchial clapping. It's like a manual percussion po. It has the same effect. But ang negative side is medyo nakakapagod. No?
So, ayan. So, same with, no, kaparehas lang din, doing the lung percussion to long COVID patients. Okay, we have, I think, one more question here. For Sir Oliver daw po, what is your message to our participants here who are also suffering from long COVID?
Well, I would say just not lose hope. It's always important to stay positive and believe that things will improve. It's been 15 months, but I've never felt bad, about feeling my how my activities have been impacted. It's just getting through it, and as what Doc Glynna had mentioned, no, slowly work on what you have been able to do today. Tomorrow, you try to build up a little bit more, and eventually, you'll get to where you want to go. Given what she had mentioned earlier, tomorrow I'll try to do a little bit more. I stay open to suggestions and stay positive. Keep on doing what you can do. I read a lot also. I try to read up on long COVID to see what. So I also understand when I was going, what I'm going through. I realized, oh, okay, I'm not the only one pala. Other people are experiencing it, and of course, I try not to react when you reveal that you're having long COVID. Some people will say, "Ay, but I had COVID," and you know, they make it seem like you're being a drama queen. Pero, I try not to react. Parang whatever. Kasi each person, each body reacts differently. So I just read up so that I see that others are going through the same thing I'm going through. Joining a support group like that, listening to webinars like this are helpful.
Thank you, Sir Oliver. And also being a part of this webinar series, no, little by little, I get to discover that even though I had COVID last September last year, it's still the strong one that I had. So it's suffering also with palpitations, sometimes shortness of breath. Sometimes I'm not feeling anything, but pag nag-check ako ng pulse oximeter, parang nagugulat ako, 92. Then I feel fine. So parang these are symptoms that really should consider and take a look at every time, no? Most especially to everyone who had COVID, no? COVID-19. Okay, we have one question here. Sir Adzhar and Doctora, how does one determine daw po which type of breathing exercise one should do? Is it coming from a doctor, from a respiratory therapist, or can just, kung yung mga naituro nyo din po, sir, would be okay na rin po for them? Thank you po.
Okay. The first step breathing, actually, you can do it while resting. Also the diaphragmatic breathing, you can do it while it's associated with the whole body exercise or workout. You can do that. And also, add ka na lang din yung aside from having the airflow limitations sa lungs ng pasyente, one factor then that can cause the difficulty of breathing of the patient is yung not using the proper muscle sa paghinga. No? Yung others kasi that what they do kapag nahirapan silang huminga, they use the upper chest or their shoulders to breathe, which is in fact not correct. So what we should do is to do the diaphragmatic breathing, the proper breathing, to like strengthen the diaphragm, which is the main muscle to help the lungs release the air and the use of oxygen.
Thank you, sir. Ayan, Dr. You may want to add something po, Doc?
Yeah, actually, basically, as mentioned by Mr. Enggal, we should concentrate also on the breathing sometimes. Kasi, of course, we know the techniques, but sometimes I encounter patients that may halong panic kasi eh. May halong panic. So, tama nga. Pero, may ganun sila. I'm reading one of the questions in the chat. He said that he used the he blows the air into the straw. So nagbo-blow siya ng straw, tapos may water. So yeah, we actually ask our patients to do that. Kasi pag blown, kasi minsan nagpapanik sila eh. So parang 5 seconds breath, 5 seconds exhalation, parang parang ganun. So minsan pagka ganun, may hilo ka talaga and you're not breathing efficiently. So by allowing air to flow through the straw, kasi doon talagang mapapractice mo yung purse slip eh. Kasi pag sinabing purse slip, parang as mentioned nga by Mr. Enggal kanina, parang whistling. So naka-purse yung lips mo. So yung blowing through a straw na may water sa dulo, yun yung resistance. And when you also blow through that, nakokontrol mo yung release. Nakakontrol mo yung release and then parang nagko-concentrate ka at the same time na dapat 3 seconds to, 4 seconds to, and na-regulate mo yung breath mo. So usually we just try to incorporate strategies para tama yung time, tama yung muscle na ginagamit, and then tama yung technique as well. So dapat sama-sama siya, technique, time, and in that way mas efficient yung breathing. Adding resistance trains kasi yung muscles to be stronger.
Thank you, Doc. Doc, can we still advise patients to do steam inhalation para po dun sa pag-loosen ng phlegm and to cough it out as well?
Usually, I think it also helps, especially kung, for example, may cold sila. So, but if you're going to talk about ano ba yung suko ba tawag sa suob yung suob, di ba? There was a time na they tell us to do that, na yung mainit. I think the medical people are saying na it doesn't really kill the virus, but it helps loosen the phlegm. If you have colds or sticky phlegm, you just have to watch out na hindi ka mapaso. So parang ganun. So it's inhalation. But sometimes if you have airway diseases like COPD and asthma, you also have to be careful because sometimes if you're using concentrated na water na may matapang na salt na nilagay mo doon, kumbaga concentrated na salt solution, sometimes it can also trigger airway constriction. So if you have COPD and asthma. So again.
Thanks, Doc. Another question, how does Symbicort improve lung function?
Sa Symbicort kasi, it's a combination of formoterol, which is a long-acting bronchodilator, and an inhaled corticosteroid, which is budesonide. So normally, for patients with asthma or COPD is chronic obstructive pulmonary disease. It's better known as emphysema for most patients. It's secondary to smoking. So what happens is there is airway obstruction. So at the same time, meron din tinatawag na airway inflammation or pabamaga ng daanan ng hangin. So when we use the Symbicort, as sa question ng ating caller or listener, it helps open up the airways kasi it's a bronchodilator. So nakakapasok yung hangin. Kasi the problem with asthma and COPD, masikip kasi yung, if this is the airway, sumisikip siya. So the formoterol component of Symbicort, it opens it up And then the corticosteroid is an anti-inflammatory also na medications kasi may kasamang pamamaga yun. So, nag-improve yung lung function kasi nakakapasok yung hangin. So, more or less parang ganon with asthma and COPD. And at the same time pala nakakalabas.
We're checking if okay po. Pag ganito po ba, Doc, during breathlessness daw po or pag may nahihirapang huminga, maybe an attack of a long COVID, when to seek emergency or immediate medical help? Some would say, katulad po nun, no, when they feel that they can't really breathe. But some, just like me, nakita ko 92, but I was okay. So I have to take it multiple times and it really shows 92. When is it a medical emergency to seek help? Lalo na kapag nagde-deplete din, of course, yung sa pulse oximeter.
Usually, dapat yung vital signs as a whole is normal, of course, muna. Pero kung if sabihin ang baseline mo normal, like for example, BP is 110 and then all of a sudden bumagsak, no? Naging 80s na lang, over 60, something like that. Of course, that's already one of the reason to seek consult. And then for the pulse oximeter, sometimes kasi nagbe-breath hold din tayo. Like meron kaming patients kasi na parang nakaslouch. Siyempre, kaya important talaga yung proper posture. Pag nakaslouch, hindi makaka-expand yung lungs mo mabuti. So, it will take up less air as compared kung naka-proper posture ka. And then, hindi ka pa nagbe-breathe and then magpapanik pa. So, usually, ganun lang talaga. So, usually, may patients nga kami na ganyan, 90. And then, i-coach lang namin, breathing, inhale, exhale. And then makikita mo umaakyat yung pulse oximeter values niya. Pero halimbawa, makikita mo yung lumulubog na talaga yung muscles dito. This is your clavicle, diba? And then there's a space here. We call it a supraclavicular muscles there. And then your intercostals, yung mga muscles in between your ribs, lumulubog-lubog yan pag talagang in distress. So yun yung mga at least physical signs na kailangan pumunta. But first of all, before we panic with regard to the pulse oximeter, let's check first our batteries. Baka naman luma na yung battery. And then tama ba yung placement? Kasi minsan nakatagilid siya. And number 3, sometimes malamig yung fingers natin. Galing pala tayo sa aircon or something. Kasi pag malamig, hindi accurate yung reading. So we check first our device and then tama ba yung temperature natin when we check our pulse oximeter. So, and then halimbawa talagang ganon with other symptoms like, fever pala or blood pressure dropping, increasing ng heart rate, and that's the time you go to the hospital.
Thank you so much, Doc. We have one more here. Doc, yung smoking cessation po ba, nagpapakos po ba siya ng shortness of breath or is it a symptom of withdrawal? That's a question from our participant.
Sa smoking cessation kasi, di ba lagi silang takot to quit because they're worried that they'll get sick. Kasi yung mga sasabihin ng mga ka-friends nilang mga smokers, pare, you'll get sick if you suddenly quit. But actually, wala naman po siyang relation with regarding dun sa developing difficulty of breathing. In fact, when you stop smoking, you improve your airways. Kasi what happens is smoking has 7,000 chemicals. And these 7,000 chemicals, other than the nicotine, which is the addictive component, the nicotine kasi goes to the brain, and that's the one that causes the addiction. But on top of that, it has other chemicals such as lead, butane, methane, carbon monoxide. All these chemicals, just to name a few, kasi 7,000 yan it causes the bronchoconstriction. So when you eventually quit, then you decrease your chances to get COPD. So kumbaga, on the contrary, smoking improves your lung capacity. Kaya lang, sometimes what happens is, panic. Kasi yung withdrawal symptoms, di ba, nagiging irritable sila and nag-hyperventilate. And then, so that's why it's important to see a smoking cessation specialist, or we have, by the way, a national quit line, which is 1558. If they have problems with trying to quit smoking, then just call 1558. It's toll free. So, and also, ano pa yung isa? Coughing. Normally, after 2 weeks, of coughing, sorry, within 2 weeks pala, when you quit, sometimes the quitters will observe na dumadami yung phlegm. What happens kasi, if a person is a smoker, there is a microscopic hair-like structures in your airways. Cilia, it's called cilia, C-I-L-I-A. They clean the airways. So kung may dirt or whatever foreign object na pumunta, they try to sweep it out. But if you're a smoker, the cilia becomes paralyzed. So all the dirt goes into your lungs. When you quit smoking, the cilia will return its normal function. So it will start cleaning again. And then, so therefore, when you actually cough, you will see blackish discoloration sa phlegm. Kasi yun na yung naimbak na dumi na nilalabas na ng body. So it's not actually something bad, but it's something good because that's the dirt coming out. So in summary, smoking is the one that will cause the difficulty of breathing, not the stopping or quitting.
Thank you, Doctora. And if you, one of our participants here, or maybe some viewers on Facebook, is seeing this webinar right now, this could be your quit date. Ayan. Yun nga po, yung
Yes.
quit line. Thank you, Doctora. Somebody is asking, Doctor, what is the latest research daw po about chronic fatigue syndrome and pulmonary fibrosis incurred after getting COVID? I've been a long hauler or a hauler since January 2021.
Well, actually, we did para local study. We just did a local study sa dito sa center on long COVID. So we did a CT scan of their of chest, and after a year, may mga improvements naman na nakikita among these patients. So in summary, with time, it also will improve, especially kung may mga activities na ginagawa. So if that question is about improvement, yes, we have actually seen improvement among patients who experienced long COVID. So,
thank you, Doc. We have last two questions. This is coming from our participant. Hello po, Doc. I'm a diagnosed asthmatic since childhood. Nawala ang asthma ko during my teenage years and then bumalik na naman po ulit ngayong I am 29 years old. Meron daw siyang Seretide as maintenance and I'm having shortness of breath. Minsan okay po yung aking paghinga, minsan hindi. Ilang beses daw po siya nagpa-RT-PCR and antigen test, where it always turns out negative. Never been diagnosed with COVID, even though yung mga kasama daw niya sa bahay ay nag-positive na po before. Ang kanyang concern is, Doc, possible po kayang bumalik ang asthma ko because of an undiagnosed long COVID?
Yung asthma kasi, actually, para madali lang maintindihan ng mga tao, I usually say na it's a form of allergy. Para lang maintindihan. That occurs in the airways. So if the condition is good, kasi di ba sa allergy, pag walang allergen or walang, limbawa, kung sa food pa yan, kung hindi ka kumain ng food na may allergy ka, you don't get the symptoms. But with asthma kasi, it's about triggers eh. So the trigger can be dust, can be smoke, stress. When we, di ba sasabihin lang, oh, when we were young, before 7 years old, I had asthma, but after 7, I don't have asthma anymore. Actually, when your immune system kasi, when you reach a certain age, nag-i-improve din kasi siya. So that's why some patients, when they are relatively more senior, bumabalik. Kasi nag-iiba rin kasi yung immune system. So may ganong factor. So may factor ng stress, may factor ng smoke. So basta walang triggers, chances are magiging controlled yung asthma. But sometimes the COVID adds to the asthma para ma-trigger. Kasi remember, in COVID, it's an inflammatory response, 'di ba? Yung normally dun sa mga nagki-critical, they say, oh, dito nag-cytokine storm. Yung cytokine, it's a release of a lot of inflammatory mediators. So nagkakaroon ng inflammation. And asthma is all about inflammation as well of the airway. So parang minsan nag-a-add siya. So nati-trigger din yung asthma. But infections can again also trigger asthma. So usually, pwedeng nandyan na lang siya, yung asthma talaga niya na controlled lang, and possibly pwedeng na-trigger. But we also have to need to know sa nag-ask if yung seretide ba niya, is he or she using it regularly. Kasi especially ngayon, mainit ngayon and that's a trigger. Yung weather natin na napabago-bago, sobrang init, sobrang lamig, it's a trigger. So usually, you have to use your controller. Seretide is a controller regularly or daily. Kasi kung ang trigger is the weather today and tomorrow and the day after will be the same. So ibig sabihin, you expect symptoms. So therefore, you have to use your controller medication on a daily basis. Parang ganun.
Like controller ang tawag, ang term po doon sa kanilang kanilang mga MDI. So if they have one
Yes,
last question, meron daw po bang standard guidelines sa exercise at breathing techniques? And this is from people who are suffering from mild COVID case. Para daw hindi po lumala papuntang long COVID respiratory symptoms.
So basically, it's wala naman talaga yung parang hard and fast rule, kasi in rehab and even in breathing, individualized din kasi yung approach Like as some patients would be, as shown by Mr. Enggal, di ba, yung iba gumagamit ng turbofort, yung iba gumagamit ng mga devices like the frequency oscillation vest. So iba-iba naman siya. It depends really on the situation. But at least those are the basic things that can be used, or basic breathing techniques that can be used, like the pursed lip and the diaphragmatic breathing. And probably Mr. Enggal can also add to that.
The breathing exercises, you can also do it at home. Like if you're doing your daily activity at home, you can do the diaphragmatic breathing since it requires the whole body to move. So you can do it also. When also during a test, you can do the pursed lip breathing at the same time.
Thank you so much. Ayan, that's about it. Once again, thank you so much, Sir Oliver, Doc Glynna, and Sir Adzhar for the very rich and enlightening discussion. Before you go, I would like to award you a certificate of appreciation on behalf of HFI. Health Futures Foundation Incorporated awards this certificate of appreciation to Mr. Oliver Calasanz for his enlightening talk on my long COVID journey in breathing better in long COVID, ways to improve lung function, webinar on the 27th of April 2023 via Zoom, given this 27th day of April 2023. Signed by the HFI President Dr. Cora de Los Angeles Anunuevo and HFI Chairman Dr. Jaime Galvestan.
Thank you. Thank you so much.
Thank you so much, sir. Next, Health Futures Foundation Incorporated awards a certificate of appreciation to Dr. Glynna Ong-Cabrera for her informative talk on breathing better in long COVID, ways to improve lung function webinar on the 27th of April 2023 via Zoom, and given this 27th day of April 2023. And also signed by HFI President Dr. Cora de Los Angeles Anunuevo and HFI Chairman Dr. Jaime Galvestan. Thank you so much.
Thank you.
And lastly, Health Futures Foundation Incorporated awards a certificate of appreciation to Mr. Adzhar Enggal for his enriching demonstration on breathing better in long COVID, ways to improve lung function webinar on the 27th of April 2023 via Zoom, and given this 27th day of April 2023.
Thank you so much.
Thank you so much. And this is all signed by HFI President Dr. Cora de Los Angeles Anunuevo and HFI Chairman Dr. Jaime Galvestan. Ayan. And before we end this webinar, HFI invites everyone to attend our upcoming long COVID webinar series. So this May 2023, as you can see on your screen, we will be having our 6th long COVID webinar entitled Tired of Being Tired, dealing with post-COVID fatigue. Our key resource speaker is Dr. Mona Lisa Dunca, a rehabilitation medicine specialist who will discuss how post-COVID fatigue affects our bodies. And we will also have Dr. Madeline Valera, who will share personal experiences on dealing with post-COVID fatigue. In June 2023, HFI's next long COVID webinar is Staying Sane with Long COVID, Dealing with Post-COVID Mental Health Issues. And this is from Dr. Maria Teresa Agustillo Villasor. We'll discuss the effects of post-COVID symptoms in our mental health. And kindly tune in to your emails and HFI's Facebook page for more details of the webinar. And we are hoping to see you there. And as we approach the end of today's webinar, HFI would like to thank Dr. Glynna Ong-Cabrera, Sir Adzhar Enggal for discussing long-term effects of COVID-19 on the respiratory system and ways to improve lung function. And of course, Sir Oliver Calasanz for sharing his long COVID journey. Of course, our utmost gratitude and appreciation goes to all of our webinar attendees today of course, their questions. And as they learn their knowledge, new knowledge that is timely and relevant to our objective of achieving holistic health and wellness. And right now, help us improve our future webinars events by answering our short evaluation form flash on your screens at https://bit.ly/LC-preval. Or you may also use your QR code scanner para po i-scan ang nakita nyo po sa inyong screen. And the link is also sent in your chat box. And please be reminded that the deadline for answering the evaluation form is up until the 28th of April at exactly 4 p.m. So 24 hours po yan. Again, I would like to remind everyone that we will only be sending e-certificates to Zoom participants who stayed all throughout the webinar and accomplished the evaluation form within the deadline. And once again, help us reach more people by following us on our social media platforms, as you can see on your screen. And in the chat box and comment section, you may visit us at our website at www.healthfuturesfoundation.com. Like and follow our pages on Facebook, facebook.com/healthfutures for your timely health tips and for the latest news and updates on HFI's events and projects. Meron din po kami, facebook.com/alaga.ka. And this is for the news and updates on HFI's banner project, Alay sa Ginhawa at Kalusugan or Alaga Ka. Follow us on Instagram and Twitter. That's at Health Futures, and subscribe to our YouTube channel at Health Futures. And we are also on LinkedIn, linkedin.com/company/Health Futures. Thank you so much for staying until the end of the program, and we hope you learned a lot from our speakers. Again, this has been Nurse Natalie, your facilitator for today's webinar, Breathing Better in Long COVID, Ways to Improve Lung Function. Para po sa inyong lahat, have a good day and stay safe.